Well, good evening, everyone. Welcome to BioTouch Healing's Health Condition Workshop on Traumatic Brain Injury. And here we are. Wow, we have a full house this evening, don't we?
We do.
Hey, my name's
We,
Paul.
hi, everybody. This is Bev. Good evening.
And down in the corner, we have our Health Condition Workshop Coordinator, Eileen Webster. Take it away, Eileen. You're introducing this whole show to us.
All righty. Hey, everybody. Welcome to our addressing TBIs and CTEs using BioTouch Healing tonight. So did you want me to tell everyone about their workbooks too?
Oh,
Okay.
introduce our guest too. Who's this other person that we have?
All right. So we do. We have another person down in the corner. This is a friend of mine, Elliot Cellini. He's in Chicago. And Elliot had suffered a traumatic brain injury in a car accident when he was 16 years old. So tonight he's going to share with us his experience with a traumatic brain injury and his journey to recovery also.
Yeah. So I'll tell everybody, if you want the workbook, we're going to have a presentation by Eileen and then Elliot, and then Bev and I will stick around and teach you the points on how to work with traumatic brain injuries. And you can download the workbook if you want. It's justtouch.com/workbook. And it's free for the month. And otherwise, if you become a member, you can download it at any time. So, all right, take it away, Eileen.
All righty. So TBIs and CTEs. We've got so many letters here, but what do they all mean? So a TBI is a traumatic brain injury, which is a form of an acquired brain injury, which occurs when there's a sudden trauma that causes damage to the brain tissue. Okay, this can happen when the head violently hits an object or is hit by an object, or when an object pierces the skull and enters the brain tissue, or a shock wave from an explosion. Now, children and older adults are at the greatest risk of suffering a TBI. And the leading cause of death from TBIs are from car accidents, suicides, and falls. Now, as far as the damage to the brain, it's the extent of the damage which determines whether or not it's a mild, moderate, or severe TBI. And so think of it like other parts of the body that get injured, and the brain develops bruises and tears in this tissue. And then inflammatory and chemical and oxidative damage that happens around those areas can then start spreading to the surrounding areas over the next few hours to days after the injury. And since the skull is inflexible, the swelling that happens can push the brain inward. Okay, so it pushes inwards on the brain, further reducing the blood flow. And then this can extend the damage over an even larger area. Right? And so if this inflammation continues, more serious symptoms can then increase over the next few weeks. But usually, not always, but usually these symptoms start to plateau and then slowly improve over the next several months. Now, as far as a mild TBI, the symptoms could be, well, they could be conscious or they could have a loss of consciousness. They may have a headache, be confused, be lightheaded or dizzy, have blurred vision, ringing in the ears, a bad taste in the mouth, feel fatigued or lethargic, or have a change in their sleep patterns. They may not sleep at all or just sleep too much. Or they may have behavioral or mood changes and troubles with memory, concentration, attention, or thinking. And now, as far as a moderate or a severe TBI, they may show the same symptoms as the mild TBI, but they may also have a worsening or unretractable headache. And that was the case with my husband. They may have repeated vomiting or nausea. They may have convulsions or seizures. And again, that's what was happening with my husband. He was having constant seizures. There may be an inability to awaken from sleep, dilation of one or both pupils of the eyes. They may have slurred speech or weakness or numbness in the extremities, or loss of coordination, and increased confusion or restlessness or agitation. But most or quite a few moderate to severe TBI patients are suffering from chronic pain and PTSD and depression. And they may even have a loss of consciousness for several minutes to even hours, or even more serious states like a stupor or a vegetative state, or even into a coma. So as far as a treatment for TBI, well, anyone who has suffered a TBI, and especially those with signs of a moderate to severe TBI, should receive medical attention as soon as possible. But unfortunately, little can be done to reverse the initial brain damage caused by the trauma. So then medical personnel will then just focus on stabilizing the patient and trying to prevent further injury by ensuring that there's proper oxygen to supply to the brain tissue, and maintaining the blood flow to those tissues, and controlling your blood pressure so it doesn't get too high and cause increased bleeding in there. Or they may also decide to do some imaging tests to check for any bone fractures, like in the face or the head, or spinal instability from the accidents. Or they may even do a CT scan to look for areas that may need to have the bleeding surgically repaired. But when it comes to treatment of a TBI, prevention is, of course, number one. And that's going to be things like car seats, helmets, seat belts, and talking to your doctor about what you can do to reduce your risk for falls. But treatment in general for a mild TBI includes resting and, of course, avoiding further injury. And for a moderate to a severe TBI, again, we're avoiding further injury. But at this point, we want to tailor rehabilitation to those areas where they've suffered the most deficits. So that could be physical therapy, it could be occupational therapy, or speech therapy, or it could be just social support, or even seeing a psychiatrist. But unfortunately, lots of TBI patients are disabled, and there aren't many who can afford the various rehab programs that are available out there. One other treatment that they're using these days for TBIs is called HBOT, which is hyperbaric oxygen treatment. And this is the use of oxygen at higher than atmospheric concentrations and pressures for the treatment of disease. So the main function of this is to temporarily supersaturate the body tissues, and in this case, the brain, with oxygen, get that nutrition and everything back in there. And the neat thing is this has demonstrated marked improvement even years after the injuries have occurred. But the downside is it's not FDA approved, and so insurance doesn't cover it. As far as the prognosis for patients with a TBI, estimates are that 3 to 5 million people in the US are living with a TBI-related disability. And this can negatively affect, of course, the person's quality of life, and of course, their caregivers and their families and even their community. And disabilities resulting from a TBI can vary too, depending upon the severity of the injury, the location of the injury, and the age and general health of the individual who's been injured. And of course, some of the most common disabilities include, problems with cognition and sensory processing and communication and behavioral or mental health. For my husband, I was finding his shoes in the microwave. I'd find the coffee pot in the clothes dryer. And other times I'd come home and find he has hidden, just randomly hidden all his medications or other important things around the house because he was afraid people were coming to get them, but he wouldn't remember where he hid them. So I got to spend my whole evening unpacking the house and finding everything we needed again. And to this day, he still remains disabled, but he's much, much, much better. Now, what the heck is a CTE? So a CTE is chronic traumatic encephalopathy, okay? And what this is brain degeneration that's likely caused by repeated head traumas. So think of the football players or hockey players or boxers and other sports, or military personnel who have been serving in war zones, or even people who've suffered repetitive physical abuse, okay? So CTE is a progressive degenerative brain disease for which there is no treatment. Okay, and the only approach right now is just, again, to prevent head injury. And the only way they can actually diagnose somebody with a CTE, unfortunately, is on autopsy, where they cut into the brain and look for this thing called tau, a type of protein, and other proteins that might build up in there. And as far as the symptoms of a CTE, there's no real specific symptoms that your doctor can use to diagnose it either, because the possible signs and symptoms of a CTE can occur in many other conditions, such as, again, difficulty thinking, memory loss, problems with planning and organization and carrying out tasks, impulsive behavior, aggression, depression, substance abuse, and suicidal thoughts, or motor symptoms like Parkinson's and motor neuron disease. So it's hard to diagnose. So the takeaway I want you to get from this is two things with a TBI and a CTE and CTE is, number one, prevention. Prevention of these injuries in the first place is the biggest key. The second thing I want you to remember is that while, again, there's no cure right now, we used to believe that the brain only had, so many neurons, and once they died, that's it. That's all you had. But we now know more. We know about positive neuroplasticity, right? The brain's amazing ability to generate new neurons and new neural pathways around these damaged areas. So again, getting that therapy is key, all right? And so I've included in the PowerPoint that Paul is going to put in the post, so you have access to this, is some additional resources. If you live in Arizona, we have the Arizona Brain Injury Alliance, and that's www.biaaz.org. Or nationally, there's the Brain Injury Association of America, and also the Brain Injury Resource Center. So thanks, everyone. And now I'd like to pass this off to my friend Elliot so he can tell you about his adventure in recovering from a TBI.
Thank you, Eileen. There's no way that I can say that I have 100% recovered, because I don't believe that any person with a brain injury could ever fully recover to how they once were. So how my journey started, as Eileen spoke, she said that I was in a car collision at the age of 16, and I was comatose. Well, she may not have mentioned that I was in a comatose state. I can't 100% recall at the moment, but I was knocked into a comatose state for about 2 to 3 weeks, and the prognosis once I woke up was not the most bright and cheery. I woke in a vegetative state. As I was laying in the comatose state and the vegetative state, I had both arms hypertensive, across my chest with fist clenched like this, and both feet pointing down and inward from the ankle. And due to the TBI, even though it overall is considered a traumatic brain injury overall, the most severe damage was to the left hemisphere, which controls everything motor movement wise on the right side of the body. And that's why I still have a holding pattern on my right arm and leg. But I would like to share with you all about how I was before the car crash. I was a part of my high school's band program and my high school's show choir program. I was a singer dancer with the show choir, and I was very active, very musical. Then the crash occurred, and I'm not 100% sure if this is a correct recollection or not, but I'm recalling that my family was told that my brainwave activity was knocked back to that of a 4-year-old brain level of activity. The symptoms that I deal with on a daily are spasticity, as I just showed earlier with my right arm and hand with the clench like this. Along with spasticity, there is fatigue, both physical and mental. Some days it's more mental than physical. Some other days it's more mental than physical. I really would have to compare my experience as very similar to if you look on a heart monitor, the downs and ups. It's very similar to that. I may have an even keel day, next day down a bit, and the following day up a bunch and down. But overall, it's a game, really. Now the various therapies that I've undergone that have helped me greatly are physical therapy, occupational therapy, speech therapy, and in fact, my speech therapist early on tried to re-engage my neuronal connections to remember a simple associative memory task, remembering my 4 therapist names and then associating each name my therapist with each of their therapy types. And none of her tactics worked, but because she knew I was into music before the collision, she started a few OT or speech therapy sessions along with music therapists. And to the tune of Farajaka, she taught me my therapist's names and associating them. They went like so. Jennifer and Lisa are my OTs. Shannon is my PT. Shannon is my PT, speech therapy with Vicky. Now, along with those therapies, I underwent neurofeedback, and that type involves using sensor pads that give a light electrical neural stimulation or a lens. And before I first started going to neurofeedback when I was at a standstill in my recovery in PTOT and speech. And from still continuing going to PTOT and speech sessions, along with going for neurofeedback sessions twice a week initially, my progression just skyrocketed so positively because at that point, it was 2 years post-injury. I was unable to walk on my own. I couldn't walk with a cane. I was able to walk with a standing walker with 2 armrests because I couldn't extend either elbow down far enough to reach the handles themselves. And just from incorporating neurofeedback with PTOT speech, after 8 months, I graduated from the standing walker to a 4-prong cane. 3 months later, after that, still continuing both neurofeedback and those 2 therapies. I went from 4-prong cane, single prong cane, a month and a half later from then. I was free, I was able to walk without anything. Along with that therapy, I also was introduced to a gong meditation therapy, and that greatly reduced. I found that to be beneficial in retraining my brain to release my muscle spasticity, because when I first sat down to meditate while the gong meditation practitioner hit the gong, um, it was really interesting because at first really wasn't any effect for maybe the first 15 minutes. And I was thinking, oh, maybe I should just get up and leave. But then I gave it a second chance. And then when I thought was only 15 more minutes, they said that, okay, thank you all for coming. We hope you really enjoyed it. And at that point, my eyes were still closed. But once I opened my eyes, I saw and felt my right arm completely relaxed with my hand touching the floor as I was sitting down on the floor. And it's very similar to the effects that I get from one touch therapy as well as Feldenkrais therapy. I cannot really come up with the words to shout my praises. It's oh. My experience through the years since the collision that caused grand axonal division in my brain is very similar. I already spoke that earlier. So it sounds good to me.
Okay. So, what an awesome story. One thing you said, Elliot, when you first came on was you were inspired. You really wanted to help bring awareness to this situation to people.
Yes.
Can you share that desire that you have for folks?
Yes, I really want my sharing of my experience to be inspirational and motivational to anyone who's listening, whether you are one who is going through the struggles of, oh, gotta get up again in the morning and then get to a therapy clinic by 8 in the morning or something like that. And then go through each of the exercises over and over and over again. Don't lose hope. Keep on trying.
Yeah, right on. And Eileen, as a sort of caregiver, what'd that feel like? What was that like for your husband to sort of not be there for all those years? How was it for you?
It was so frustrating, and I felt so helpless. I would see at that point, we didn't know what to call them, but episodes. I would see the episodes start to happen, and I felt helpless. There was nothing I could do but just sit and watch and hope he would come around eventually. And these episodes would last anywhere from, oh my gosh, 20 minutes to 12 hours, where I would get no response out of him. I was actually preparing wills, preparing because I thought this was just going to get worse and worse, because it seemed like he was just getting, we were running into brick walls, trying to get any kind of answers or help for him. And we also lived in a very rural area where we didn't have all these therapies available to us. And we didn't have the insurance to cover them either. And so it was a matter of myself and neighbors taking turns watching over him. But then I would have to go to work. And at one point, heck, I got 2 dogs, and I trained these dogs to stick Steve in his chair. So if there was no one available to keep an eye on him, these dogs would sit at his feet. And if Steve started to get up and started moving around too much, they would bark and jump on him and get him back in his chair. So a funny way to end this is that to this day, those dogs still try to do it. And if Steve tries to dance, they start barking at him and push him down in a chair.
That's funny.
So one other question before we move on to teaching BioTouch. Elliot, you took the class out there in Chicago with Kai, yeah, to learn how to.
Yes.
Have you had BioTouch done to you?
Previous to the session, the class, I had not.
Huh.
But what I did have was something very similar to BioTouch.
Right.
It's called Feldenkrais.
Right.
It was founded by a man by the name of Moshe Feldenkrais
Right.
in Israel quite a number of years back.
So what was it like for you to learn it?
It was really eye-opening, and it really opened my mind to a whole new world.
We like those songs.
Yeah.
And Eileen, have you been able to use BioTouch with your husband?
Yes. As a matter of fact, since we've moved down to Tucson and I found BioTouch, the first time I did it on him, on his head, it stirred up some interesting traumas, I'm going to say, from the initial accident and everything. But then a few hours later, he was back to his normal self and with a sense of humor.
Hmm.
And now our family and friends, they would swear, this is the same old Steve.
Right. Yeah.
He's got a sense of humor, a great wit, and yeah, it's been magical for us. And the great thing now is, just since I mentioned the seizures, whenever I think I start to see those little quirks that he has, I don't know if he's going to have one or not, but I just start in with BioTouch right away, and
right on.
Hopefully that's been what's kept them away, I hope.
Well, on that note, we're going to take the next little time here to teach it. And Eileen, we appreciate you setting this up. Elliot,
Yes.
inspiring. Thank you for sharing your journey, and we hope to have you around more often. So we're going to take a transition here as the two of them leave, and Bev and I will take over and teach these points. Thanks, gang.
Thanks, Elliot.
Bye.
Thanks, Eileen.
Thank you, Elliot.
Bye.
All right, so let's go to the two hosts. Here we are, Bev and Paul.
Here
Woohoo!
we are.
Wow,
Once again.
that was totally inspiring. So,
Oh my gosh. I think I wanted to ask him, but then I forgot. When he took the BioTouch class training, was he actually able to do BioTouch with somebody? Because it's not just always about you being touched, it's about you being able to touch.
Right.
And we know that BioTouch is a relationship, so I can't help but think that Elliot, by doing BioTouch, is just going to, wow, what a great thing for him to be able to help somebody else.
Yep. So I did want to share, just before we move into teaching these points, I know Jenny's son-in-law
Yes.
was a field goal kicker. And Bjorn Nitmo was his name. He actually had an article in ESPN, and it was sad. These guys on these teams, because nobody knows about it, years later, they're becoming angry, suicidal. They leave their families. They leave a mess behind them because there's no control. There's not a choice in these traumatic brain injury or CT. What is it? CTE? Yeah, CTB. Yeah. No, CBT. That's all these, like Eileen said, too many. Yeah, but it's always like, God, if we could get BioTouch, and here we're going to learn it. If you could do this immediately, and then family members could do it, the kids could do it, everybody could get involved, and so let's teach some of these points on what to do with BioTouch, and we
Okay.
have again justtouch.com/workbook if you want to follow along. Otherwise, we'll just show it to you here, and we'll show you some of the videos too.
Right. So Paul and I always like to do a little introduction because hopefully we're always going to have new people joining us on our workshops. And just to give you a quick overview of, if you do have the workbook on page 6, there's a little overview here called What is BioTouch? And we usually go over these 4 bullets you see. First of all, let's show you what BioTouch looks like. It's the first 2 fingers of your hand. Yeah, the first 2 fingers of the hands you're using. These are your tools, your BioTouch tools. And you're going to take those 2 fingers and you're going to very lightly touch on the skin. BioTouch is a system, it's a technique, so it has specific sets of points. And this is what we're going to be introducing you to tonight, those specific sets of points that we are going to give you to address brain injuries. So to begin with, you take the first 2 fingers, lightly touch on the skin. And so the definition of BioTouch is one person touching another person lightly on the skin, like a butterfly, we say. So it's very, very light. In fact, it seems the lighter that you touch the body, the louder that touch is felt in the body. So BioTouch is about giving the body what it needs to address basically every condition that the body can manifest. BioTouch can address. It's amazing. So let's just go through these points. The BioTouch is easy to learn. I guess some people say, oh, it can be overwhelming, but this is why we decided to start doing these wonderful workshops, because we're just addressing one issue, one health condition at a time, and giving you just those sets of points, so it's not overwhelming. We do have a great link on our website. You can go and basically find all the workshops that we have done. So that's always accessible. So BioTouch is easy to learn. Even children have learned it. Children have become very effective, and also they have become practitioners and certified practitioners. So, I always say that BioTouch, when we embrace BioTouch, we are as children, because it's so safe and so just brings 2 people together in a wonderful, sacred relationship of healing. So we usually say that we have a associate, the one who gives BioTouch, and the recipient, the one who receives. But the associate really entails being in equality. So this is a relationship of equality. When you practice BioTouch with another person, it's giving and it's receiving, and both parties. That's what happens in a true relationship. So children can learn it very easily. Everybody can learn it and practice it effectively the very first time. BioTouch is inherent in all of us. It's really there for all of us to claim as a birthright. So it's a complement, we say, to any healthcare program, whether you're under the care of a doctor, whether you're doing other modalities or a specific diet. BioTouch can only enhance those practices. So we like to say that it's a complementary, not an alternative. Everything works with BioTouch. So it's integrated. And we know that it is holistic, because we only address the body. That's what BioTouch is here to do. It only addresses the body, and then all that is being held in that body. And so we don't, we don't have to diagnose or suggest anything to anybody. We're just honoring with BioTouch that person's body's ability to heal. And so we don't offer anything like that. We just touch. There's no levels of ability. Every single one of us is effective the first time that you learn BioTouch and you use BioTouch. You don't need to have any special talent or training. You don't have to have a knowledge of the body. You just need to be a person that cares about another person. And we all really are that naturally. So nothing to go through. There's no fixed timing or steps or preparation for anything. There's no belief that's necessary. The foundation itself, we do not have a belief system. We are here to just hold this technique for everyone. Whatever you believe, however you believe, whatever your state of mind, whatever your belief system is, everything is acceptable and honored with BioTouch. So we say it breaks down all of our barriers. So we don't address the mental or the emotional state of anybody. There's no need to do that. We just know that the body holds all of that and knows what to do with BioTouch. So having said that, let's move through before we go into our first set called the greeting. We want to wash our hands before you do a session or practice BioTouch with anyone. Wash your hands. And then you always begin with what we're going to teach right now. It's called the greeting. And again, using the first two fingers of your hand, lightly touching on the skin, and holding everything, every point 6 to 8 seconds. And that's it. That's it. Once you can do that, you have got BioTouch down. We do have this page terms that are used in the manual, but those are just to identify the ways that we touch using BioTouch. So we don't usually go through those in the workshops. So let's go to the first set, the all important, profound, it's called the greeting. And the greeting is, you want to always do the greeting. If you only do the greeting, you still started the body in a state of awareness. So you want to always do the greeting. And this is like opening the door for the body. It's the key that opens the rest of it. So it's very important that you begin with that. This is the only set in the video we're going to watch. We say you're only going to use one hand, and that's the only set that you're going to be doing that. It's very simple, just 2 points. So let's go ahead and watch the video that's going to show you how to perform the greeting.
The greeting is always performed at the beginning of each session. It's the only set that uses one hand and the only set that indicates which hand to use. The greeting is performed with the dominant hand. If you are right-handed, use your right hand. If you are left-handed, use your left hand. The greeting is made by touching at point 1, which is in the fleshy area just below the bottom of the breastbone or sternum. Hold this point for 6 to 8 seconds. Then, with the same 2 fingers, touch point 2 on the back. To find point 2, look for the big bone at the base of the neck. From here, move 1 to 1.5 inches to the left. This is point 2. Hold this point for 6 to 8 seconds. More than one associate may work with a recipient provided that all of the associates perform the greeting. If the associate or the recipient leaves the session, or if someone who hasn't done the greeting touches either the recipient or the associate, the greeting must be reestablished. Then the session may proceed from where it was interrupted.
Okay. So there, that's the greeting. Always perform that first. And then we're going to move into the, we put these workbooks together with specific sets of points that we feel that will address any condition, any specific condition. And of course, if we're talking about a brain injury, we want to begin with the headset. This is everything that is concerned with the brain can be addressed with the headset. And so, of course, this is where we're going to begin. So let's go again to the video and let's see how the headset is performed.
The headset can be used to address conditions related to the brain. There are 4 steps in this set. In step 1, use through fire to touch points A and A. Point A on the back of the head is in the center of the neck at the base of the skull. Point A on the front of the head is at the center of the forehead where the forehead begins to curve to the crown. Step 2 is performed in crossfire with the fingers of each hand touching on opposite sides of the head. Hold at X, which is in the indentation beside the neck muscle at the base of the skull. It is the same as point 1 of the back set. On the opposite side of the head, touch points 1 through 5. Points 1, 2, and 3 are on the ridge line formed where the skull curves up toward the crown. Point 1 is above the outside corner of the eye on the ridge. Point 2 is above the front of the ear on the ridge. Point 3 is above the back of the ear on the ridge. To locate point 4, move down the head toward the base of the skull to a horizontal indentation approximately 1/3 of the way down from the top of the ear and 1 to 1.5 inches behind the back edge of the ear. Point 5 is opposite hold point X at the base of the skull. Point 5 now becomes the new hold point as points 1 through 5 are touched on the opposite side of the head. In crossfire, touch point 1 above the outside corner of the eye on the ridge. Point 2 above the front of the ear on the ridge. Point 3 is above the back of the ear on the ridge. Point 4 is a horizontal indentation approximately 1/3 of the way down from the top of the ear and 1 to 1.5 inches behind the back edge of the ear. And point 5 is opposite hold point X at the base of the skull. Step 3 is performed in matching fire, touching points 1 and 1, 2 and 2, 3 and 3, 4 and 4, 5 and 5. Finally, in step 4, place the open palms of both hands on the head covering points 1 through 3. Be careful, don't let your hands touch each other.
Okay.
Let me just chime in here in the background. For all of you who just saw that, our manual is designed where you saw the picture first, the little drawing, and on the second page, those words that you see up on the screen right now are exactly the same words that you heard in the video. So if you're better at reading and finding the points, there they are. Watching, hearing, numerous ways to learn how to do these.
Yep. Yeah, it's the manual set up very, very simply but very strategically to teach BioTouch. It's really put together very well, I must say. Okay, let's go to the next set that we suggest, and this is the neck set. And you know, you think that it's just for neck pain, but in this case, those nerves that, if you remember in the greeting, we were talking about that big bone at the base of the neck, which is the source of the nerves that go into the head. So we want to make sure that we're working along those nerve patterns that go into the brain. This is just going to be an extra really great set to use in conjunction with the head. And the other thing is that that big bone is a source of the nerves in the upper extremities. So in Elliot's case, he was talking about he has problems in this right arm. So that would also be very helpful in addressing something like that. So let's go ahead and watch the video and the next set.
The neck set is used for addressing most headaches, neck pains, and soreness of the upper back. These points are performed in matching fire on the large muscles that run along the back of the neck. Points 1 and 1 are halfway down the neck on the side of the large muscles. Points 2 and 2 are at the top of the neck on the side of the large muscles at the base of the skull. Points 3 and 3 are at the bottom of the neck on the side of the large muscles. As with any set, you may repeat the points as many times as you like. These points may be touched in any order, such as touching points 2, then points 1, and finally points 3.
Okay, very simple as you can see, but very effective also, working along those, that large muscle that holds those nerves. The next set that we want to introduce to you is the stress and anxiety set. And as the traumatic brain injury, your body is going to be under stress. And so this set addresses anything that can manifest from an emotional or a mental stress. And so this is, again, another very simple set, but extremely effective in helping the body to deal with trauma. In this case, physical trauma. So let's go ahead and watch the video.
The stress set may be used to address any manifestation of physical, emotional, or mental stress, as well as anxiety and shingles. Hold at X, which is in the fleshy area just below the bottom of the breastbone. It is the same as greeting point 1. Then with the other hand, touch points 1 and 2, which are the same points as in the heart set. These points are found by imagining a line running from the notch at the top of the breastbone to a place on the left breast where the nipple would be on a youth. Divide this imaginary line into thirds. Point 1 is at the top of the first third. Point 2 is at the top of the second third. These points may be touched repeatedly, and remember to touch each point for at least 6 to 8 seconds.
Okay. The last set that we suggest is called the Metabolism set. And this is a really effective, great set to use because it really helps the body to get rid of and to bring in what it wants, what it doesn't want. So it's a kind of a balancing act here. It helps with all kinds of things. So the metabolism for sure is something that you might consider using for somebody, even though you might not think. BioTouch gives the body all the resources it needs to open it up to healing itself. So this is a great set. Let's go ahead and watch it on the video.
The metabolism set can be used to help the body assimilate what it needs and eliminate what it doesn't need. The metabolism set has 2 steps. Step 1 involves touching points in matching fire along the large muscles on the front of the neck. Points 1 and 1 are located above the collarbone in the soft indentations on both sides of the notch at the top of the breastbone. Points 2 and 2 are halfway up the neck on the front of the large muscles. Points 3 and 3 are at the top of the neck on the front of the large muscles. The second step involves holding a point on the front of the body and touching points next to the spine on the back. Hold point X on the front of the body is on a line directly between where the nipples would be on a youth and is 1 to 2 inches to the left of the breastbone. Another way to find X is 1/3 of the way up the breastbone from greeting point 1 and 1 to 2 inches to the left of the breastbone. The points on the back are located next to the spine, forming a rectangle around the breakover point. The breakover point is where the bottom of the rib cage joins the spine and can be found by imagining a line directly through the body from greeting point 1. To perform step 2, find hold point X on the front of the body and touch points 1 through 4 on the back. Point 1 is approximately 1 to 2 inches up from the breakover point on the left spine muscle. Point 2 is directly across from point 1 on the right spine muscle. Point 3 is 2 to 3 inches below the breakover point on the right spine muscle. Point 4 is used to address blood sugar problems and is added to the other metabolism points when needed. It is located across from point 3 on the left spine muscle.
Okay.
There we go.
Oh, that's quite an array of opportunity. All those sets are wonderful, and if you just by doing those, you're going to greatly benefit somebody that's having some traumatic brain issues.
We can't encourage you enough, especially in the beginning times. A little answer to your question. Elliot was able to share BioTouch in that class.
Oh.
Yeah, he wrote us. He posted that. Yes, I was able to do BioTouch with someone. So.
Oh, that's awesome.
And then he wrote a little acrostic poem. BioTouch, boundless, innate, organic, touch, opening, universal, connection, healing.
Oh my goodness.
Woo-hoo!
Elliot, you get it. You got it. That's it. That's exactly right.
That is inspirational.
Wow.
We hope you've all been inspired to learn BioTouch. Let us know how we can help you. justtouch.com. There's our email address on the screen, office@justtouch.com. There's our phone number, 520-323-7951. Website shows you all kinds of things. Come to our Mondays with Bev and Paul show to talk more about it. Ask us questions. We're here to help.
We are. We're always here. I would like to say thank you to Elliot and Eileen again for being a part of this workshop tonight, and to all of you who joined us.
Yes. And pass it on. This will be in an email. If you'd like to get it in an email, it's on our website, justtouch.com. Forward it to whoever you want, and let's pass healing around.
Let's share BioTouch, everybody. Yep.
See you, Bev. Thanks.
See you, Paul. Thank you, everyone.
Bye.